We know that the places that we live matter for our health and well-being in all sorts of ways. The environments we're exposed to affect our behaviours, whether that be use of tobacco, of alcohol, what we eat, our obesity levels and so on. So there's lots of evidence suggesting that the environment that we live enables and constrains us in all sorts of different ways. It's also true for our mental health. We know, for example, aspects such as green spaces, the parks that we have in the neighbourhoods in which we live is strongly related to mental health outcomes amongst children, amongst adults and indeed amongst older people. So there's multiple ways in which places influence our behaviours, health outcomes at different stages in our lives. So over the last 30 years or so, if we take the example of smoking tobacco use, there's been a significant drop in the prevalence of smoking in most countries across Europe. And the reason for that isn't to do so much with education or individual reasons. It's more to do with the environments in which we live. So the tobacco-related environment has changed in all sorts of ways. We're constrained in the ways, the places in which we can smoke, the availability of tobacco we know is also a key factor in terms of explaining smoking. But also the local norms, so who is smoking, where are they smoking, what is a normal behaviour. We know these things are clearly related to the use of tobacco. So the environment and places have played a big role in terms of the really dramatic gains that have been had in terms of reduction in smoking prevalence. Well, we know that the way in which targeted interventions such as educating people about the dangers of smoking or a healthy diet or around alcohol use are received by different populations in different ways. So typically if we put out public health messages that something is good for you or something is bad for you, it's often higher socioeconomic groups that will respond to that much more quickly than lower socioeconomic groups. So if we ended up focusing our public health interventions on interventions and information campaigns, we'd end up only reducing behavioural outcomes amongst higher income groups, which would lead to a much greater inequalities in terms of those outcomes. And that's what we've seen indeed in terms of outcomes such as smoking behaviour. I think it's also making sure that environments are supportive for health. Do they support healthy eating? Is there nutritious food available? Does it support giving up, quitting smoking? I.e., has marketing and advertising tobacco products been removed from communities? Is it a denormalised behaviour? All these things are important in terms of the places that we live and help to support healthy behaviours. Most of our work has been in Scotland, but we've also done some international comparative work. And what comes out in our research is that green spaces, or as you say, open spaces, natural spaces, matter for a whole host of health outcomes across the whole life course, right from early age, even before children are born, in terms of the relationship between green space exposure of mothers and then of the birth weight of their children, right through to the life course, right through towards the end of life in terms of outcomes such as cognitive ageing, cognitive ability, and indeed in terms of mortality. We see this in lots of different outcomes. Where we don't see it, perhaps more surprising, is in terms of physical activity. So based upon data in Scotland at least, there doesn't seem to be the same sort of relationship we might anticipate between green space and physical activity. We might anticipate that if you live in a place with lots of green spaces and park, that might encourage you to be physically active. But in fact, it seems to be lots of other factors that are much more important than that. So we finding the relationship to green space and health is most pronounced amongst mental health related outcomes. That's right. So One of the problems with previous research looking at the relationship between environment and health generally, but including green space and health, is that we often look at very short time periods. So we might look at, say, green space exposure amongst adults and then look at their mental health outcomes or their physical activity. But our argument is that we need to think in much longer time frames. So things that happen to us or the environments we lived in early in our lives, we might anticipate has lifelong implications for our health. And that's what we've been trying to test out. So one example of that has been looking at green spaces in childhood and in adolescence and how that's affected health outcomes much later in life. And what we found is that yes, there does seem to be a strong lifelong relationship. If we live in greener places when we're children and adolescents, then that seems to affect health outcomes after the age of 70, including cognitive change after the age of 70 and mental health outcomes. So our study's been one of the first really to look at these environmental factors over the full life course rather than much shorter time frames than's been done in previous work. When we started the research, we were really interested in this idea that green space in early childhood matters for health outcomes in later life. So that was one of the real motivations. We did think this might be the case, but it hadn't been shown before. So it was less a surprise, but actually quite an interesting and a novel finding. We were perhaps expecting that the environment in adulthood and later adulthood would matter too. So whether you lived in a green environment when you're an adult or in older age, we thought that would also have an effect upon cognitive change and mental health. But that seemed to be less important than the environments in early life. So that bit of it was interesting, but also a bit of a surprise too. So we've looked at different aspects. So with regards specifically to mental health, there are lots of ways, and it's actually a rather contested area. How do you actually capture people's mental health? What's the best way to do it? But we had to use the data that were available to us, and so we looked at some well-used measures of depression and measures of anxiety, and those were the aspects that seemed to be related to green space. But we also looked at the not entirely unrelated area of cognitive change. So this is a test of your cognitive skills, your memory, recollection, and so on, which we know often does change when we get into older age, but it doesn't change equally for everybody. So we're interested in what are the factors that perhaps might make you more resilient to a decline in your cognitive functions. And one of those factors in our research, this particular aspect of the research, seemed to show that green space actually did lead to greater resilience to cognitive decline. We found amongst adults at least that there isn't a relationship between green space and physical activity. So what our findings have shown is there is a relationship between green space in childhood and cognitive decline after the age of 70. And so our argument is that those childhood years, those adolescent years are so formative in terms of the way in which we go on to use those spaces later in life, that they've actually have lifetime effects. So if we're more likely to have used a park and have had parks available when we were very young, then we're more likely to seek out those sorts of spaces throughout our lives and use them and with positive health benefits.